Hi, and welcome to this week's How to Do Social Distancing Properly. Now, I've been getting some questions. What's the deal with masks? Should we be wearing masks when we go out to the store or when we go out for essential errands? I know the CDC put out recommendations that everyone should be wearing masks when going out in public. So let me answer a few questions about that. Number one, should we be wearing masks? Yes, we should. But remember that masks protect the other person from you. When I wear a mask in surgery, I am protecting my patient and my patient's open wound from my nose and mouth germs. When I'm wearing a mask in surgery, there's probably some element of protection that the mask offers me, but what I'm really protecting is the sterile environment, the sterile field that's developed over the patient, and so that the bacteria, viruses, microbiomes that are in my nose and mouth are not getting into the sterile field. So then why would you wear a mask if you're not feeling sick? The reason to wear a mask is because there is a 5 to 10 day period of asymptomatic viral shedding before you actually get sick. And so you are protecting everyone else potentially against the virus that you might be shedding. So think about that. If everyone wore a mask, no one would be transmitting the disease, or at least not at the same rate. So let's talk about a couple different kinds of masks. Now, this is white gold here. This is an N95 mask. So this is the thing that hospitals and doctors' offices desperately need. So I am asking you, I am begging you, if you have one of these, if you have a stash of these, please donate it to a doctor's office or to your local hospital. There's a massive shortage of personal protective equipment, PPE, as you've probably heard on the media. This is what doctors need to work with known infected COVID patients. This is one of the few things that can actually protect the wearer from virus coming in. I've seen people wearing these in the grocery store. You do not need this for the grocery store if you're practicing hand washing, gloves, a cloth mask, and proper social distancing. You do not need it, so please don't need it to your hospital. The reason that I think it probably doesn't even work at all in people wearing it in the grocery stores is a lot of the mistakes that I've seen is that, number one, when we wear these in the hospital, we are fit tested beforehand to know which size we wear. So for example, this is one that we just happen to have at our house from before. This actually probably doesn't fit me. It's a little bit too big. It doesn't quite fit me in the chin. The only way that these work is if there is a complete seal all the way around your nose, all the way around your mouth. So number one, if you haven't been fit tested, you may be wearing the wrong size mask anyway. Number two, if you have been fit tested and you're wearing this mask properly, it should be extremely hard to talk to anyone, and it's actually pretty hard to breathe. I have operated with these on, and it's challenging because the airflow is so restricted in these. The other thing that I've seen at stores is people wearing these and then still, touching their face to adjust the mask, which does the same thing that I illustrated in the ketchup video. When you're putting your hands in contact with your face while you're at a store, you're bringing all of the bacteria, virus, whatever that's living on the shelves onto your face. So it defeats the point of wearing a mask. Or I've seen people wearing the mask and then they see their friend and they go like this to take it off and talk to their friend. So if you have one of these, just donate to a hospital, please. The other option is what the CDC is talking about is probably cloth masks, which that can be a bandana, it can be a homemade mask. The important thing there is that you need to put it over your nose and your mouth. Just putting it over your mouth still lets any viral particles come out of your nose and defeats the point. So if you're gonna wear a mask, you're gonna put it over your nose and your mouth. I would tie it tightly wherever it needs to be tied. When you get home from the store or from wherever you're going, untie it. Do not touch your face. Untie it from behind. I would take it and put it in the washing machine, put it down, wash your hands 20 seconds, soap and water, same as you would anytime that you're returning from the store or from an errand, and then go about your social distancing at home. So the point of all this is stay home. That is all most of you are being asked to do. Just stay home. Wear your cloth mask, wash your hands, but stay home. And if you have personal protective equipment, please donate it. Someone can come pick it up so that you can stay home.